Hi, I'm Steven with Dynamic Defense Solutions, and today we're going to be talking about first responder skills in the pre-hospital setting. And more specifically, we're going to be talking about placing your patient in the recovery position. So what is the recovery position? The recovery position is a position you put an unconscious patient in after you've completed your full assessment. The recovery position allows gravity to keep the tongue forward and fluids out of the mouth and nose, such as vomit and blood. We're only going to put our patient in the recovery position if we know this won't create any further harm to the patient. Now let's talk about how to put someone in the recovery position. Ensure the patient is in a safe area away from any threats or harm. Be sure there is no obstructions that would inhibit positioning the patient. Straighten the patient's body as much as possible. On the side closest to you, place the patient's arm above their head in line with their body. Bring the opposite arm across the patient's chest and place on patient's shoulder nearest to you. Lift patient's far side leg at the knee and hold. Using the patient's raised leg, support the head as much as possible and log roll the patient. Use the patient's knee and elbow as a kickstand to support the patient's weight in this position. Adjust the head as needed to ensure the face is pointed downward, helping to maintain the airway. Monitor the patient in this position until professional help arrives or until exfil is possible. Mylar or other survival type blankets can be used to maintain the patient's homeostasis and prevent shock. Shock is a fatal condition that we want to do our best to avoid. Shock signs include pale, cold, clammy skin, shallow or rapid breathing, difficulty breathing, anxiety or altered mental state, rapid heartbeat irregularities, or palpitations. Now let's go over putting a survival blanket on a patient in recovery position. Unfold survival blanket behind the patient. Tuck in the blanket underneath the patient's back. If the blanket is shorter than the length of the patient, prioritize coverage over the patient's head and torso. Wrap over the patient and tuck in under patient's opposite side. Ensure that the face is left uncovered so reassessment is manageable. Again, monitor the patient in this position until professional help arrives or until exfil is possible. If you have a survival blanket available, it's a safe tool to use if shock is a concern. Remember, we are not placing our patient in the recovery position if we feel this will cause further harm. And that's pretty much it. If you have any questions, feel free to reach out. If you're interested in any other first responder skills, tune into our other videos, and we'll see you next time.